afternoon, and welcome back to Butterscotch Entertainment. Today we will be taking questions about the United States healthcare system.
Our first question comes from our president.
How does healthcare work? That's a very good that's a very good question, Mr. Trump.
Well, JP, if someone gets ill, it's likely that they will have to go and get treated for it. The U.S. government does fund two kinds of health plans, through Medicaid and Medicare. They're especially designed for the elderly, the poor, the disabled, and the young. However, many Americans have their health care paid by their employer.
I hope that answers your question, Mr. Trump.
Our next question comes from Obi, who says, Obi, do you have any questions for Butterscotch Entertainment? For those of you who don't understand, don't worry, I speak dog. He's asking, how does the U.S. healthcare system match up to other countries?
I got this one. Well, the U.S. has spent more per person on healthcare than 12 other high-income nations in 2013, while seeing the lowest life expectancy and some of the worst health outcomes among their group. According to a Commonwealth Fund report, the analyst shows that in the United States, which spent an average of $9,086 per person annually, life expectancy was only 78.8 years. Switzerland, the second highest paying country, spent $6,325 per person and had a life expectancy of 82.9 years. Now, on top of this, prices of health services are considerably higher in the U.S. than elsewhere. On average, heart bypass surgeries cost $75,000 in the U.S. compared to $15,000 in the Netherlands, where the procedure is less expensive. This means I could literally fly to Netherlands, first class, eat lobster throughout the whole plane ride, and it will still be more than half the cost of what it costs here.
Wow, JP, that is a lot of information. Thank you so much for that. But to move on, our next question comes from our former president, President Obama.
Alright, so Mr. Obama is asking, should we repeal Obamacare?
You know what? I think we should get the public opinion on this. With that, we have Casual Bianca, our field reporter.
Casual Bianca?
Thank you, Bianca and JP. I am here today with the people at Eagle Pass asking if we should replace Obamacare. Vanessa today. Vanessa, do you think we should replace Obamacare?
Yes.
Thank you. So, cameraman number one, what do you think? Should we replace Obamacare?
Yes.
Thank you. That is all the information I've gathered for you today. Back to you, Bianca and JP.
Thank you, Casual Bianca.
So, JP, do you think we should replace Obamacare?
I think we should.
If we replace Obamacare, should we have a single-payer system? And what are its pros and cons? And how are we going to pay for it?
Before we can answer that, you need to answer, what is a single-payer system?
Well, JP, a single-payer healthcare is a system in which the state, rather than private insurance, pays for healthcare costs. Single-payer systems may contract for healthcare services from private organizations, as in the case of Canada, or may own and employ healthcare resources and personnel, as in the case of the United Kingdom.
Right, so knowing this, we can answer, how do we pay for it? So this type of healthcare plan is mostly financed by the savings governments will get from replacing today's inefficient, profit-oriented system with a non-profit, single-streamlined public payer system. Another source of funding for single-payer health insurance is through the modest new tax proposals that are based on the ability to pay. Bernie Sanders' plan to tax those that are earning above $250,000 and more. Under this type of health plan, premiums would disappear and more than 90% of American households will be able to save money that would otherwise be channeled into insurance payments. Those that need medical attention will no longer face financial barriers to receive health care, such as copays and deductibles, and they will be free to choose hospitals and doctors. Moreover, single-payer health insurance would enable doctors to regain autonomy over patient care. So now, hearing all this, what do you think, Bianca?
I think that we both can agree that we should have a single-payer healthcare plan because it outweighs that of Obamacare.
It's pretty good. So from our newsroom to your living room, I hope that we've answered all your healthcare questions.
This was Butterscotch Entertainment, signing off.
Bye.
Bye. Come here. Sit right here with me. Do you record it?
Yeah.
Butterscotch, do you have any questions for Butterscotch Entertainment? Thank you.